See my screen?
Yeah, doctor,
Hello?
we are able to see your screen.
Okay, yeah. Okay, so I'll turn on my video for a while, for a second. Then say hello, or probably later. Okay, I'll start. So today I'll talk about the technology called medical microwave radiometry and how we've used it for the measurements of internal temperature of brain. So in this you can see the device and you can see points. So what the unique features of our device? As you know, temperature is the first indicator of various disorders in the human body, and the thermal changes as a rule precede structural changes and arise the early stage of the pathological process, and in many cases characterize the risk of the disease. So changes of temperature can be caused by increased metabolism in cancer cells, pathological development in microcapillary networks, inflammation process, vascular pathology, trauma, and any other disease conditions. So unfortunately, the molecular mechanism of internal microwave emission from the biological objects and human body is not still known very well. It could be caused by structural conformation during the catalytic events, protein folding, unfolding, changes including human fluids properties, blood and cerebrospinal fluids, etc. So this is the device. The device actually already being used more than 10 years in different clinics. The first application was a breast cancer, but now a lot of clinics using it for the assessment status of brain. So we have two devices available, and the device is about, it's like laptop and connected to laptop, and we can measure internal temperature down to almost 6 centimeters, and plus the accuracy is plus minus 2. And the feature of this device is we can measure so-called infrared temperature that most of the thermometers measuring, and internal temperature. Infrared temperature can measure only skin. It's infrared radiation cannot penetrate the skin. It's only 5 millimeters deep. So what you could see on this picture here from the infrared sensor, it's only skin temperature. And we could see the high temperature, say breast or something. It means the pathological development, say cancer, are already visible. It means this is a very, very late stage. So the other device you could use is called functional MRI, but as you understand, it's more expensive. So our device, it's a passive sensor. It's not irradiate anything, and this is the reason it has no side effects. So we have a high sensitivity. We are working now with this device for the 0.1. We can detect pathologists to the stage. We could visualize results, and of course, it's low cost. The cost of the one examination, because it's no reagents, is almost zero. So so far we applied it for different therapeutic areas, and as I've mentioned, it's for breast and other cancers. So differential diagnostic, malignant and benign tumors. We can monitor treatment, earlier diagnostics, and of course we can detect inflammation as well. And you could see this called thermograms, or visual representation of emissions from the, in this case, breast. So this is the other application is a stroke. Again, so we could monitor temperature after attack during treatment, and we can determine state of the brain damage. And with the help of this device, we could calculate the optimal dosage and the type of therapeutic intervention. This another picture showing you a young guy who boxer, and we could evaluate brain condition before and after any match on sport trauma, including boxing, football, baseball, or whatever could cause the brain trauma. And Greek colleagues recently published investigation about the importance of measuring temperature of the carotid arteries, and they show that if carotid arteries temperature increase, internal temperature, it could cause this stroke with much higher probability. So the low back pain, so we could visualize back pain. It's no other technique that could visualize back pain. Phlebology, you can early detect venous diseases, including the so-called diabetic legs. Urology, again, early stage of the cancer or acute pyelonephritis, renal colic, melanoma, upper back pain. These other applications are non-clinical. You see the xenograft mice, and we have done to understand more mechanisms. We have done in vitro experiments on the protein kinetics, the denaturation kinetics, and enzymes kinetics when we measuring microwave emission from the enzyme assays. We found that they could emit microwave radiation. We have done it for cytochromes, and we have done it for peroxidase reaction. And it's, as you know, these cytochromes and peroxidase oxidase reactions are very heavily involved in different pathogenic properties. Pathogenic events. So now brain temperature. Brain temperature, you can see the device you've seen, it's on the picture below on the right bottom corner. So this is how it's device applied for the patient. And we are measuring in 9 points. The 9 points of the left hemisphere and the right one. So altogether it's 18 points. And you could see in healthy patients, the temperature is in blue, it means normal. But if you have a patient with stroke, you see in stroke and left side of the brain, you could see immediately the temperature raised from 36 to up to 39, it could be even 40. So but the non-affected areas, they have a low temperature like 35, and the difference between high and low, this temperature heterogeneity, that's very important for assessment and diagnostics. So what we could measure, again, we could measure dynamics. Dynamics means these healthy individuals and patients with stroke, and the difference in patients in chronic critical conditions. The correlation between temperature indicators in symmetrical areas gives us as I've mentioned, temperature distribution. And we applied it and ran some statistical analysis. And the next slide, you could see the healthy patients, healthy people are characterized very medium strength of heterogeneity. In patients with acute period of stroke, they have a very high heterogeneity, and the patients in vegetative state, we can see the reduced of all of such activities. So, as I've mentioned, we applied this for the sport trauma, and on the A, you could see this healthy boxer before the sparring, and on B, before a fight, with just 20 minutes warm up, you see the brain become warmer. And this just immediately after the sparring match, and 7 punches to the head were missed. And you see specifically in the left side of the brain, and you see the 40 degrees increase in the internal brain temperature. Fortunately, after 1 hour of sparring, the temperature goes down, not very quickly. So we have some hypotheses why it's happening. One of the hypotheses is it's because of the denaturation of protein denaturation during the trauma. So in this slide, you can see it's being submitted and most likely will be published in a couple of next months. So we measured circadian rhythms in healthy patients and the patients with brain effective. You see here the patients in vegetable state, and this is normal circadian rhythms, and this is almost missing circadian rhythms of the brain activity of the patients in this state. So what does it mean? It means the measuring temperature could be an indicator of brain functioning as well as consciousness, of course. So conclusions are an increase or decrease on the temperature heterogeneity of the cerebral cortex could be indicator of state of conscience and stroke and chronic compartment. And we are doing some experiments now with schizophrenia and other neurological diseases, and we have a very good correlation between the temperature heterogeneity using microwave and the symptoms. So low temperature difference is associated with increase of activity in inflammation blood biomarkers, so low level of antibodies, and in most cases there's good response of patients to therapy. On contrary, high temperature is typical for patients with insufficient activity of inflammation markers, high level of antibodies, and more severe course of diseases with likely resistance to therapies. Fortunately, there are some methods how to reduce heterogeneity or lower the temperature by thermal effects on cerebral cortex. And colleagues, that's my co-author of this presentation of paper, Professor Shevelov, using the period of cooling and warming in his research. So other conclusion is the increase of high level temperature between the areas may indicate the destruction of functional connections in the central CNS. In the acute period of the disease, it's accompanied with development of growth lesions and correlate with significant decrease of level of conscience, predict a poor prognosis of the course of outcome of the disease. I would like to say that regardless of initial cause, which include trauma, severe disorders of cerebral circulation, temperature heterogeneity was lost in all patients with development of vegetable state or the other states when the patients has a loss of consciousness. And the revealed pattern, the standpoint of ideas about long-term functional systems, this was developed by W. Ross Ashby here in UK, Piotr Anokhin and others across the world. It was all the theories were developed quite a while ago, but it was good we found confirmation of this more theoretical work using our experiments with brain temperature measurements. I would like very quickly mention that we applied the artificial intelligence recently, and we could detect 90% accuracy of the breast cancer, 80% of venous diseases, and COVID-19 induced pneumonia, about 80% sensitivity at early stages. So we published, and we hope to collect more data of measurements of microwave emission from brain, so we could detect early stage of the brain disorders. So for further reading, I would recommend you paper published last year on using medical microwave radiometry from brain temperature measurements, together with Professor Shevelov and Professor Vesnin, who is my co-presenters. And I would refer to for general publication of drug discovery today. 2 years ago, this passive microwave radiometry in biomedical studies that we explained and show more examples and more details. So I would like to thank my colleagues and University of Edinburgh and different Federal Research Clinical Center for Resuscitation and Rehabilitation in Moscow, where almost all experiments were done, and the company Medical Microwave Radiometry provided funding for this study. Thank you.
Thank